All right, let's dive right into this, shall we? Yeah, we got a lot of questions recently about Botox.
Yeah, seems like everyone's curious about it these days.
For sure. And, a lot of those questions, they're really focused on the experience itself. Like, what can you really expect when it comes to, pain or discomfort during the treatment?
Right. Makes sense. It's natural to want to know what you're getting into, especially with something like Botox.
Absolutely. So that's exactly what we're going to unpack today in this deep dive. We're going to break down the basics of Botox, what it is, how it actually works, and then we'll really get into what you can expect, feel, all that good stuff.
Yeah, and we'll look at those common questions, separate fact from fiction. Gotta have the right information, right?
Totally. Knowledge is power, especially when it comes to making decisions about, things we're considering for our bodies.
Exactly. Informed decisions are the best decisions. So, to kick things off, let's just lay that foundation. What exactly are we talking about when we say Botox? Well, the simple version is it's a substance that comes from a specific kind of protein.
Okay, so protein-based, and we've all heard about its use for wrinkles. I mean, that's kind of the big one, right? Smoothing out the skin, reducing those lines.
It's definitely the most well-known use, and it works by essentially relaxing those muscles in your face that create wrinkles when they contract. But here's the thing, it's not limited to just cosmetic stuff.
Oh, really? So there are medical applications too?
Absolutely. Doctors use it for a whole range of things, migraines, for example. Botox can be a lifesaver for people who suffer from chronic migraines.
Wow, I didn't know that.
Yeah, it can be really effective. And then you have things like excessive sweating, certain types of muscle spasms. It's quite versatile, actually.
That's amazing. So how does it actually work then? I mean, how does it go from a protein to, relaxing muscles and smoothing wrinkles?
Good question. So when Botox is injected, it kind of acts like a messenger blocker. You see, our nerves constantly send signals to our muscles telling them to contract. That's how we move, right?
Right, makes sense.
Botox essentially intercepts those signals, specifically the ones telling the muscles to contract. It stops them from reaching their destination.
So the muscles don't get the message to tense up.
Exactly. And that's what leads to the relaxed muscle and ultimately smoother skin. It's temporary, though. The effects usually last around 3 to 6 months, depending on the individual.
Okay, so it's not a permanent change. And this whole messenger blocking thing, it's all thanks to a particular ingredient, right?
You got it. The active ingredient in Botox comes from a bacterium called Clostridium botulinum.
That sounds kind of intimidating. Bacteria.
You know, right? But don't worry, it's used in very small, very controlled amounts. It's all about targeted precision. We're talking tiny amounts, carefully injected into specific muscles to achieve the desired effect. And the way it works is by stopping the release of a chemical called acetylcholine.
Acetylcholine. What's that?
Think of it as the go signal for your muscles. It's a neurotransmitter that tells your muscles to contract. Botox basically says, nope, not today.
Interesting. So it really is very targeted. But where exactly is it injected? You mentioned wrinkles, migraines, sweating, muscle spasms. I'm picturing injections all over the place.
Well, not quite all over, but yeah, the injection sites do vary depending on what's being treated. For wrinkles, the most common areas are the forehead, specifically between the eyebrows to smooth those frown lines, and around the eyes to target crow's feet.
Right. Those are the classic ones.
Exactly. And then you have the jawline, sometimes to create a slimming effect, and the neck for those pesky neck bands.
I've heard of a lip flip, too. Is that Botox?
It involves injecting a small amount of Botox around the upper lip to relax the muscles, giving the lip a slightly fuller, more flipped appearance. It's quite subtle, though.
Okay, that makes sense. But what about those medical uses we talked about? Where are the injections for those?
For migraines, the injections are typically in specific muscles in the head and neck. For excessive sweating, they're usually done in the underarms, hands, or feet, depending on where the sweating is most problematic. And for muscle spasms, it really depends on which muscles are affected. It could be anywhere from the limbs to the back, even the bladder.
Wow, so it really is versatile.
Mm.
But all this talk of injections, it's got me thinking about pain. Now, that's a big question for a lot of people. Does Botox actually hurt?
You know, it's not as bad as many people imagine. The most common description I hear is that it feels like a quick pinch or a tiny sting.
Like a bee sting?
Some people do compare it to that, yeah. But honestly, most find it quite tolerable. And generally speaking, Botox injections are reported to be less painful than other types of injections, like vaccines or dermal fillers.
That's good to know. But I imagine everyone's different, right? Pain tolerance and all that.
Absolutely. Several factors can influence how much discomfort someone experiences. Things like the practitioner's skill and technique, your individual skin sensitivity, even the specific injection site.
Right, that makes sense. So let's talk about managing that discomfort. What can people do to minimize any potential pain?
Well, even before the appointment, there are a few things you can do. Avoiding alcohol and blood-thinning medications for a period before the treatment is often recommended.
Why is that?
It can help reduce the chances of bruising, which is a common side effect, albeit usually mild. And staying well hydrated in the days leading up to your treatment can also help minimize bruising.
Makes sense. So preparation is key. What about on the day of the treatment itself?
There are some great tools available to help with comfort. Topical numbing creams can be applied to the area beforehand to numb the skin, and ice packs, both before and during the procedure, can also help dull sensation.
Ice packs, huh? That's interesting.
Yeah, it's simple but effective. And then there's the mental aspect. Don't underestimate the power of your mindset. Practicing some deep breathing exercises can actually go a long way in helping you relax and manage any anxiety you might be feeling.
Oh, definitely. I know when I'm anxious, everything feels worse. But what about during the actual injections? Any tips for that moment?
Well, as we said, the procedures are usually pretty quick, often just 10 to 15 minutes. But even in that short time, distractions can be your best friend. Listening to music, chatting with a practitioner, anything that takes your mind off the needles. And a skilled practitioner will have their own techniques for minimizing discomfort too.
Right, experience makes a difference for sure. So what about after the treatment? What can people expect then?
It's normal to have some mild soreness in the treated area. Ice packs can continue to be helpful for managing that. The key thing is to avoid rubbing or massaging the treated area for at least 24 hours.
Why is that so important?
It helps prevent the Botox from potentially migrating to unintended muscles.
Ah, I see. So it's about keeping it right where it's supposed to be.
Exactly. And of course, if you experience any unusual or persistent pain or notice any signs of infection like redness, swelling, warmth, or any discharge, contact your doctor immediately.
Right, better safe than sorry. Speaking of things to be aware of, what about side effects? What are some of the more common ones people might experience?
Most side effects are minor and temporary. Bruising is a common one, as we mentioned. A slight headache, some redness or tenderness at the injection sites. These usually subside within a few days.
And what about those rarer side effects I've heard about, like droopy eyelids?
Those can happen, but they're less common, especially with a qualified and experienced injector. Allergic reactions are also possible, but again, quite rare.
So it's really about choosing the right practitioner and following those aftercare instructions carefully.
Absolutely. And speaking of things people should know, let's tackle some of those common myths floating around about Botox.
Yeah, there are a lot of misconceptions out there.
For starters, the idea that Botox is always extremely painful, as we've discussed, that's simply not true for most people. Then there's the myth that it's a permanent solution. Again, not true. The effects are temporary, lasting months, not years.
Right, it's not a one-time fix. And I've also heard people say Botox will make your face look frozen, expressionless.
That's another misconception. When done correctly, Botox aims for a natural look, preserving some movement and expression. The goal is enhancement, not eradication.
So it's about subtlety, not a completely frozen face.
Precisely. And then there's the concern that Botox is toxic or unsafe. While the bacterium it's derived from can be dangerous in large amounts, the purified and controlled doses used in Botox treatments are FDA approved and considered safe when administered by a qualified professional.
That's reassuring. It seems like a lot of the anxieties come from misunderstanding the science.
Absolutely. Information is key. And speaking of advancements, the field is constantly evolving. There are actually newer Botox methods being developed, some of which are designed to be even less painful.
Oh, really? Tell me more about that.
One method is called microbotox. It involves using smaller doses injected at multiple points, resulting in a gentler sensation.
So it's like spreading it out a bit more?
Exactly, and some practitioners are using vibration devices near the injection site to distract nerves and minimize pain perception.
Wow, that's innovative. So less is more, and a little distraction goes a long way.
It seems so. And let's not forget the ongoing research into new topical numbing agents that could further enhance comfort during the procedure.
It's fascinating to see how things are progressing. But even with all these advancements, are there any things people can do on their own to make the experience more comfortable?
Absolutely. Breathing exercises, as we mentioned, are fantastic for calming nerves and managing anxiety. Taking good care of your skin, keeping it clean and moisturized, can also aid in healing after the treatment. And some people find it helpful to track their pain levels and results over time to personalize their approach and communication with their practitioner.
That's a great tip. Knowing your own body's responses can be so empowering.
It really can. And for more resources and information to help you on your well-being journey, I encourage you to visit https.payhip.com/flourishreads.
Absolutely. Lots of valuable information there. So as we wrap up this deep dive to Botox, let's recap the key takeaways. Essentially, Botox works by temporarily relaxing muscles, which can smooth out wrinkles and treat certain medical conditions. It's not a permanent solution, the effects typically lasting a few months. And while there might be some initial discomfort during the injections, it's often described as a brief pinch or sting.
And the great news is that newer techniques and preparation strategies are constantly evolving to make the experience even more comfortable. So don't let fear of pain hold you back from exploring Botox as a potential option. Knowledge and open communication with a qualified practitioner are your best allies.
So true. And it all circles back to that initial question, does Botox hurt? Well, it seems like the answer is a lot more nuanced than a simple yes or no.
Exactly. Individual experiences vary, there are ways to manage discomfort, and the advancements in the field are quite promising.
This exploration really highlights the importance of being informed, right? Understanding the science, knowing what to expect, and feeling empowered to make choices that align with your own well-being goals.
Couldn't have said it better myself. It's all about making informed decisions, and hopefully this deep dive has equipped you with the knowledge to do just that.
Absolutely. And for those who are keen to delve deeper into this and other fascinating topics related to health and well-being, be sure to check out https.payhip.com/Flourish Reads. We've got a wealth of resources waiting for you there.
So many great things to explore.
Well, on that note, thank you so much for joining us for this deep dive. We hope you found it informative and insightful.
It's been a pleasure.
And as always, thank you for listening to the Flourish Reads podcast.
Until next time.